on the web, and in your hands. This is MDI TV.
When would you like to schedule your stroke? You know, the ones with the loss of feeling on one side, confusion, difficulty speaking, potentially life-threatening consequences, that kind of stroke. Of course, you can't schedule a stroke. It can strike at any hour, any day. But let's just say you could schedule a stroke. Would a Tuesday be better than, say, a Saturday? With a stroke, quick and appropriate treatment can make all the difference. Would the weekend crew at a hospital give you the same quality of care as the weekday crew? That's the question researchers wanted to answer when they sifted through more than 8 years worth of reports on every patient from every hospital in Virginia who was given a diagnosis of ischemic stroke. That's the kind caused by a blood clot in the brain. The results? Patients admitted on weekends were just as likely to survive as those admitted on weekdays. What's more, the weekend patients were more likely to be treated with a clot-busting drug called TPA. TPA treatment is recommended if it can be given within 3 hours of when the patient first feels the symptoms of a stroke. The data couldn't tell researchers exactly why patients admitted on weekends were more likely to get the recommended TPA treatment. But among the guesses, maybe patients are more likely to go quickly to the hospital on weekends. Or maybe hospitals just aren't as busy. The lead investigator on this study, Dr. Abby Casely, says they did notice that patients who went to an accredited stroke center were slightly more likely to survive.
Already discussed, it could be that primary stroke center certification really ensures that the standards are the same around the clock every day of the week, so that the access to the CT scans, the access to the neurology expertise has to be there, whereas that might not be the case with some of the other conditions that have shown to have a weekend effect, like heart attack.
Part of winning accreditation as a stroke center is being staffed and equipped to handle stroke cases any day at any time. Stroke centers are also required to have procedures in place to move suspected stroke patients to the front of the line in the ER, have expert caregivers on hand, and get a CT scan within minutes. That scan is key because while TPA can save brain tissue in a patient with a clotting stroke, it could make things much worse for a patient with a stroke caused by bleeding in the brain. That's called a hemorrhagic stroke. Dr. Paul Ash, a neurologist at an accredited stroke center in Oregon, Legacy Meridian Park Medical Center, emphasizes the importance of having all the recommended hospital procedures in place.
And those guidelines have been proven, and structured care has been proven to be the most effective treatment we have for improving stroke outcomes. More important than this TPA that they talk about, and that's in the paper, by the way, that the structured care that is outlined in the certification criteria is of major benefit to patient outcomes.
And the guidelines don't take off nights or weekends because neither do strokes.
The public can be assured that since stroke does not choose its time to be, 8 to 5 on weekdays, that their care is not compromised whenever they have their stroke. And they can get in right away and they will get the care that they need. And that's very reassuring to all of us.
Some other studies have come to different conclusions about the readiness of hospitals. For instance, some studies that looked at heart attack patients found those admitted on weekends did not fare as well as those who went to the hospital during the week. But this study of stroke patients, at least, found that weekend care was just as good or maybe even better. And it suggests some ideas for future studies that could reveal more about why care sometimes varies so that hospitals can learn how to improve.